there, I'm Joyce Graff. This is The Powerful Patient, and I have with me Catherine Anderson from the UK, who's going to talk with us about subglottal stenosis, or SGS. So welcome, Catherine.
Thank you very much for having me.
Thank you. So tell us about this condition.
Well, subglottic stenosis is a condition which affects predominantly women, and it's a build-up of scar tissue just below your vocal cords. There are 4 different reasons you could have this. One reason is that you may have been intubated, so having a tube down to keep you breathing during an operation, and if the cuff pressure, there's a sort of a cuff that goes around that tube, is too tight, it can cause pressure on that part of the airway and result in scar tissue afterwards. There's a lot of people now who are post-COVID who are getting it, but who were intubated in the ICU to help them breathe as well. I know there's a lot more people getting it. Autoimmune diseases can cause this. There's a disease called, the initials are GPA, or it used to be called Wegener's.
Yeah.
Not anymore, but yes, that's a disease which can affect all sorts of parts of your body, but also can impact your airway. And
right, let me just stop you for a second. So stenosis means narrowing, right?
That's correct, yes.
Right.
This is caused by scar tissue.
A built up of scar tissue, but some way of narrowing your breathing passage, your trachea.
That's
right?
correct.
And it happens below the level of the epiglottis, which is sort of the doorway between your esophagus, where the food goes, and the trachea, where the air goes.
That's right. It's a little airway bit between. So you've got if you put your fingers on your throat and you talk, you can feel a little vibration where your vocal cords are going. Now, if you go about 1 centimeter below that, that's where the scar tissue generally occurs. So it's quite close to your vocal cords, and it can travel up or down as well. So, but generally.
Right. So sometimes, if you get a drop of water going down the wrong throat, as we say, then you'll feel that it's headed down your trachea into your lungs, which is not the right thing to do. So you have the food tube, and then you have the air tube, and the air tube gets narrowed for some reason. As you say, there's a whole list of reasons why that may have occurred, but it can also just sort of happen spontaneously for no known reason.
Yes, for myself, for example, I was about 30 years old, and suddenly out of the blue, I was struggling to breathe. It sounded a bit like I had asthma. I was camping with some friends when I first heard this noise. I thought, my instant thought was, I've got a chest infection, because I didn't know there was anything else that could make you sound a bit wheezy when you don't have asthma. And it was a struggle to go walking, and I sort of pushed through. Then I saw the doctor, and the next, the doctor said, well, there's, chest is clear. I've sent for x-rays, and automatically then put me on inhalers, saying I had adult onset asthma.
Right, so asthma is one misdiagnosis of this condition, because obviously asthma is a great deal more prevalent in the general population. So they tend to go first to the more common things that are happening. How did you get from asthma to this diagnosis?
It took a long while. I persevered with inhalers, and I kept seeing the doctor again and saying that they don't seem to make any difference. And I was struggling walking up hills, and I then changed doctor, saw a new doctor, went through my whole history, and she said, right, I'm going to send you off to have some proper tests with a respiratory specialist. So I went through a stress test, and all sorts of tests to see, and he said, oh, no, you don't have asthma. I think you've just got anxiety, which is a great diagnosis. I was furious with him because I knew that wasn't, I was anxious because I couldn't breathe. It wasn't the other way around. So I think it probably took nearly 2 years. I finally saw a third primary care doctor, GP, and she immediately heard me breathing and said, you have a stridor. And I was like, wow, okay, this is a new word. I haven't heard this before. I said, well, what does that mean? And she said, well, you're wheezing on the inward breath and the outward breath. And as patients, we describe this as Darth Vader breathing, that sort of inward and outward again. And that's what, triggered her to say that it was an upper airway, something in my upper airway. There was something blocking my airway. So she then sent me back to the evil doctor who'd said I've got anxiety, and wrote him a very stern letter and said, put a camera down and have a look. And he said, I'm not going to find anything, but he did it anyway. And lo and behold, he found a band, like a web of scar tissue across my airway. And I was breathing through about a 4 or 5 millimeter wide hole. Think about the size of a straw, a cocktail straw.
That's interesting. So let me first say that, say to everyone that if a doctor says it's all about anxiety, take that with a very large grain of salt, because that is a very common thing for especially men doctors to say to women. We used to say, the doctor would say to you, just buy a new hat, you'll feel much better. They think that women are exaggerating their symptoms, but you are with your body 24 hours a day. The doctor is seeing you for 15 minutes once in a great while. And so, yes, your attitude about what's going on in your body is valid and needs to be respected. And if you don't like the answer, then maybe you need to seek a different doctor. So I'm glad you did that and you got a better idea of what was going on.
Definitely.
And that he actually did that test and discovered this issue. So you had scar tissue. There's usually some reason for the buildup of scar tissue. Did you find any particular reason that might be valid?
No, he said that it was out of his expertise and referred me to another specialist who was an ENT doctor, who then said it was out of his expertise, but he knew another doctor who had a patient. And it was at this point I realized, okay, this is something quite unusual I've got.
Yeah.
I mean, I was reassured it wasn't cancer, so I thought, oh, well, someone can fix it. But when I finally saw my second specialist and he said, oh, well, he's got 3 patients, I thought, 3? This is not very good. Who's got more? And anyway, I stuck with him for a while, and he did my first surgery, which was a dilation surgery. We're using a laser under a general anesthetic. They use a laser to cut open the scar tissue, and they do that all endoscopically, so down through your mouth while you're asleep. And yeah,
so this is ear, nose, and throat specialist and a respiration specialist were the ones who seem to be getting to the bottom of this. Is that right?
Predominantly the ear, nose, and throat, and they're not just any ear, nose, and throat. It generally have to be a laryngologist. So ENTs can be experts in all sorts of areas, but a laryngologist really specializes in the larynx and the airway. So that's the type of doctor you really want to see when you've got something like this.
Right, and it is rare. This doesn't happen frequently, but it happens more frequently in people who have been intubated. Is that correct?
It does, yes. So, and they tend to be diagnosed a lot quicker. So if they've been intubated and then they struggle breathe, struggle to breathe, it's normally within the first 3 months that's, post-op that they notice a change. Whereas when it turns up spontaneously, there's no clues as to what it could be. And so, which is why they automatically lead to the asthma conclusion, because as you said, it's, if it looks like a horse, then it's probably a horse. Don't assume it's a zebra, whereas I was a zebra, which is,
Yes. Yes. But zebras do exist. And so
Yes.
we need our doctors to be conscious of that as well. So
Indeed.
you mentioned the wheezing, the stridor breath or the wheezing, coughing and breathlessness are also things that may go with this condition, or a buildup of mucus sometimes. Tell us
Yes, I think
about that.
the mucus is generally, I didn't have any mucus at the very beginning of my journey. I think I didn't really notice the coughing. What I did cough, but it wasn't quite so bad. But the more surgeries I had, because it wasn't just one surgery, that got worse. When I had my first surgery, I thought my first surgery was my cure. It was amazing when I woke up and I could breathe again. Oh my goodness, the difference. I felt like I could fly. I was an absolute oxygen high. It was, but 18 months later, was out on a hike and I could hear this sort of whistle in my breathing again. And I thought, oh, no, surely not. My doctor said that he had a patient, his other patient he hadn't seen for 11 years. I thought, surely it can't be coming back. And I sort of left it and it gradually sort of got worse and I could hear my breathing, and people at work would say, yeah, I can hear your breathing again. And so I went back and saw him, and yes, it had come back, it had closed back up again, and had to book in for another surgery. And that was such a disappointing day when you realize that this is not a one and done, it's a repeated operation.
You were mentioning too earlier that there are other kinds of more extensive surgeries that have been recommended that may or may not actually be beneficial. So tell us a little bit about the things to be a little bit skeptical about.
Yeah, there's all sorts of things. I mean, what some doctors will tell patients that, I think back in the 90s and 80s, this has only been known about since the 70s. So it's not been around that long. So if you think maybe the last 50 years, doctors have been aware of this. Probably before that, people were just dying of asthma. And nobody did an autopsy of their throat to find out there was something wrong. So in that time, there was all sorts of theories about what might cause it. And one of those was that reflux would be an issue. But this disease generally impacts women, whereas reflux is very common. I think it affects 60% of the population, the adult population, men as well as women. And so you'd wonder, if it really was the cause of this, why don't men more frequently get this disease? So that is one of the myths. And I have heard patients going off and having quite major stomach surgery to try and treat reflux, and they don't even have reflux, and it doesn't change their airway at all. They still have operations and it still returns. But, yeah. There are a number of surgeries which do work with this disease, although there's no actual cure. So the most common one is the one that I had to begin with, and it's called a dilation, and it's often using a laser to cut the scar tissue, sometimes a laser with a balloon, and sometimes just a balloon. So they use these balloons in heart valves and all sorts to inflate and stretch. And when they use it in the airway, they often sort of cut with a very small knife to make sure it stretches open along particular lines and opens up that scar tissue. So that's kind of the most common one, but within a year or 2 years, most people have the scar tissue return. Some people get a little bit longer, but that's the most common. And then there's a couple of more major surgeries. There's one where they actually cut out the segment of your neck, which is scarring. It's quite a major operation. And that can get patients on average about 10 years without it returning, but it generally does return. There may be the odd patient where it doesn't return, but because there's no known cure, this doesn't always work permanently.
So it may be caused by injury, as we said, with being intubated. It could also be some sort of chemical burn or some sort of heat exposure burn, like I suppose if you were in a fire and you were breathing smoke for a while, that sort of injury to the breathing tube can cause it. But if they can't figure out why it was caused, then they call it idiopathic, which means I have no idea what's going on. But
it's a great word. It sounds fantastic. I was so excited when I had this really long name for my disease. I was like, oh, now I know what I've got. Idiopathic subglottic stenosis. Looked it up. Idiopathic, don't know what causes it. Subglottic, just beneath the vocal cords. Stenosis, narrowing. And I went, it's a description. It's not a, it's not a name.
No, that's true.
It was disappointing, yeah. And then you realize it's.
So I saw that you have a sort of handbook that you've put together for people with this condition. The different things the doctors may tell you, whether or not they have been found to be helpful, things that you can do to ease the condition a little bit or to treat it yourself at home. So tell us about how you managed to get all this good information compiled through patients, through physicians. What was the journey in assembling it?
It was a whole range of sources. So in 2009, I set up a Facebook support group called Living with Idiopathic Subglottic Stenosis. And I guess it was because I was alone. I was completely by myself. I had no idea, am I the unusual one that it comes back after 18 months? Am I, are there other people out there like me who are sort of going for lots of operations? And what else is people trying? There's acupuncture work, So through the group, we sort of started discussing and talking to each other. And my whole career has been in research. So I've been a research director for, various jobs, but basically the last 25 years I've been in research. So I'm a bit of a geek. So once I had more than 100 people in my group, I started doing some research. And then I started contacting doctors. And I guess I became this sort of central point for doctors to send me their papers. They shared me information. And I would contact doctors with things that came up in the group. So people would suggest different drugs or maybe different herbal therapies. And I would test that with doctors and whether they thought it was a good or bad idea. And so because I didn't want fake news to be in the group, basically. I didn't want people to be taking advice, the wrong advice, and getting sicker. And so the guide, the rough guide, I call it, started because I kept seeing the same questions again and again from new members in the group. And I thought, okay, it's a bit tiresome. Let's get everybody up to the same place. We'll get everyone to read this at the beginning of their journey. And then everyone learns the same, and then we can actually progress our discussions further. And so that was really a compilation of a lot of the advice I got from doctors, things in the group, everything I wrote in the book, then went out to doctors to double check. So we have sections in there about dealing with this during pregnancy. And some of the top doctors who've dealt with the most patients who are pregnant have given advice about how to deal with them and at what point have operations and what other options they might have. So there's a lot of toing and froing. So it's a combination of talking to doctors. I read medical papers, which are incredibly complicated. I mean, sometimes every other word you need to look up in the dictionary to try and understand what it is.
Yes.
I do that hard work in order to translate it into patient language and make it easy for people to get the latest advice. And it's, it's changing all the time. I update it probably once or twice a year, depending on what the latest advice is. So,
terrific.
And yeah, because of that, we've, the group has grown. We've had a lot of doctors join the group as well who'd like to they don't join in, but they watch and they listen just to understand that patient experience, which is fabulous, because I think when we started, no doctor ever thought that there was any other issue other than, okay, it's narrow, I'll operate and say goodbye, see you when it's narrow again. And they don't really understand what happens in between. And it's a huge amount, so yeah.
Well, you've done a wonderful job, and I think that's marvelous. And every rare disease needs someone like you to assemble the information, both patient experience and doctor's experience. Both are valuable. We know a lot about our own bodies, but that doesn't mean we've been to medical school, So, so we do need the addition of that professional expertise. But we also need to make sure that they're listening to us. So it's that combination that's most powerful. Yeah. I should point out too, when I was pregnant, I had a superfluity of postnasal drip. What do they call it? Rhinitis of pregnancy, which is not uncommon thing. And so if someone with even a mild narrowing of that passage has that postnasal drip, that could be a complication right there.
Absolutely. Yeah. I think a lot of people discover they've got this during pregnancy, and there was a lot of debates amongst doctors as to whether it's it's brought on by pregnancy, so whether the hormones have created this problem, or it was already growing and they didn't know about, they lived quite fine. And exactly as you said, the pressure of having an issue, plus things like the postnasal drip, having a baby press on your lungs creates difficulties breathing as well. And I think there's a whole compounding of issues going on there, which can, create quite a dangerous situation for the mother.
Right. But I saw that you've done quite a bit of statistical analysis based on and it's not an enormous population, but as you say, it's more than 100. So it statistically has some significance, and it's very valuable to get that perspective on the condition.
Indeed.
So thank you very much for doing all that hard work. And we hope that anybody who's experiencing these kinds of issues will get hold of your book. How do they find you? How do they get hold of your rough guide to SGS?
The easiest way is to join the group, and the latest version is always there's a link to it on there, so people can always get hold of the latest one, because it's being updated every 6 months or so. That's probably the easiest way, and that's through facebook.com/groups/airway stenosis.
Okay, and I will put that also in the comments for the show. Yeah. So it's facebook.com groups airway stenosis.
That's right.
Okay, great.
I'm also on Twitter, and I share a lot of things on Twitter as well. So you can find me there as Sparky Sparkler.
That's great. Sparky Sparkler on Twitter.
Yeah. But yes, I contact a lot of doctors and a lot of speech and language pathologists, they are all on there following me and sharing things I post as well, because a lot of people need to learn about it. Anybody who's misdiagnosing patients with asthma, or maybe they've got female patients with asthma who are continuing to struggle, and they think, well, maybe this could be it. That could be the next step, is to have a look. Yeah.
Right, and the idiopathic version is extremely rare, but there are many other causes of this condition that are much more common. And so anybody who's struggling with difficulty breathing should get hold of this little book and take a look at it and see. One of the things you recommended was the use of a nebulizer. Tell us about that.
Yeah, so a nebulizer is a device which it basically creates clouds from water. So it's something that will put water, when you breathe in through a mask or a mouthpiece, will put water into your airway. You and I talked about earlier about drinking a glass of water and it goes down the wrong tube. And you generally will have a choking fit, won't you, when that happens, because it's going to your lungs instead of your stomach. With this, because the particles are so tiny, you get the moisture into the trachea, which really helps soothe that area. It helps move mucus a lot easier, and it will reduce the risk of mucus plugs, which are a huge problem for patients with this. We did some research with the group a few years ago about the use of nebulizers, and most doctors were not recommending them. They weren't not recommending them, they just weren't even telling patients that they were a good idea. And yet those patients who were using them, they were all experiencing a great decrease in their bad symptoms. The nebulizer that I recommend would be something that's handheld and silent. A lot of the ones you get from your local pharmacy are plug into the wall and they're very loud. They're like a vacuum cleaner, and you can't really watch the TV with that going on, you know, using this mask.
Right.
Whereas a silent one, it's so tiny, it fits in your handbag, and you could sit there with your husband or your partner and do this while you're watching the television or in bed while you're reading a book, and it's, you know, doing you so much good, and that's a highly recommended thing.
Right. At least we give you symptomatic relief, which is, of course, very welcome when you're trying to breathe.
Indeed.
Well, thank you so much, Catherine. I really appreciate you contacting us, and we're very glad to have you here today. So again, it's facebook.com groups airway stenosis, and we'll put the information in the notes for the show as well, so people can find their way to you easily. So congratulations, and wish you great success in improving things for people with subglottic stenosis. Thank you. And thanks everybody for joining us today. And we hope that you'll be well and be a powerful patient.
Thank you.
Thank you.